At the time that Mandy was diagnosed with diabetes, the doctors told us that she was going to have to take insulin by injections, and that was very frightening for Mandy.
When I first learned that I was going to live the rest of my life injecting insulin, I was terrified. I'm a severe needle phobic.
I don't know anybody who likes needles, and when I heard about the needle-free INJEX system, it really seemed too good to be true. But when I tried it, I was amazed at what I found out.
INJEX has been proven to be just as effective as an insulin syringe. To a doctor, that's very important. And to a patient, it's also important, but they also get the benefit of not having to stick themselves with a needle.
Lightweight and easy to use, the INJEX needle-free injector system delivers insulin and other medications into the tissue under the skin without a needle.
I didn't like the needles. I didn't like the idea of it. I thought they were going to hurt each day.
You never get used to needles. You never get used to needles. To have to watch Mandy shoot herself with needles 3-4 times a day is awful for a parent.
Unless you have a phobia, most people can't understand what goes through my mind when I think of injecting with a needle. And at the same time, it's hard to describe how calm I feel about using the INJEX. It's night and day.
If you need insulin, you'll want INJEX. Instead of using a needle, INJEX propels a fine stream of insulin through a tiny opening at the end of a disposable ampule. The pressure gently pushes the insulin through the skin and into the subcutaneous tissue.
I don't dread taking INJEX because it doesn't hurt like it would when they gave me a shot.
After using the injections and the insulin pump, we knew there was a better way. We had to find something for Mandy, and that's when we learned about the INJEX.
The actual INJEX injection, it doesn't feel like anything. It just feels like somebody put a little pressure on your skin, nothing more.
INJEX is easy to use. Just set the injector using the reset box. Draw the dose into the ampule through the vial adapter. Load the ampule into the injector. Slide the safety ring to off. Select the injection site. And push the trigger release to inject. After injection, the single-use ampule may be disposed of in an ordinary trash container, eliminating the hassle of needle disposal and the risks of accidental needle sticks. Detailed instructions are provided in the INJEX instruction manual and training video.
The INJEX procedure is really simplistic. What I really like about it is it's really extremely small and compact. It can fit in my pocket, very unnoticeable. Setting up takes only about 15-20 seconds to set it up, and you can take the shot and be done with it in no time at all. When using INJEX in a public place, there's no worry about throwing away needles and somebody getting a hold of them because it is needle-free. If I was on needles, I would be concerned about what happened to the needles after I threw it away. Well, with INJEX, I don't have that worry whatsoever.
And the shot itself is so benign that you can shoot multiple times in the same spot and there's no scarring, and it doesn't hurt.
There are 2 INJEX systems available. The INJEX 30 delivers between 5 and 30 units of insulin, and the INJEX 50 delivers from 10 to 50 units. Both models inject a fine stream of medication, about the size of a human hair, through the skin and into the tissue in a fraction of a second.
The INJEX is very effective when compared to using the insulin syringe, and I think that's very important since I take insulin myself. I want to make sure that the effects that you want from a certain amount of insulin is the same as if I gave it through a syringe. And so through our clinical studies at the University of California, we show that they're basically very effective and equal in their action.
Since we've used the INJEX, we have had more control, and it's not a dreadful time for Mandy like it used to be.
Well, you click it, it's done, you go on with your life.
INJEX with insulin has allowed me to take control of not only my diabetes, but also my life, and that's a wonderful feeling.
The INJEX needle-free injector system takes the needle out of diabetes. Its patented soft shot technology provides a virtually painless option for subcutaneous injection. INJEX is gentle, safe, discreet, and just as effective as a needle and syringe.
I spent quite a long time not thinking I had a future. And even though I'm getting up to the half-century mark, I see that I've got 40 years left because of the INJEX. It's just bottom line.
I don't feel my fear of taking needles was a phobia, but more of a hatred of being stuck. I hate causing pain to myself. And the INJEX system was a wonderful alternative.
With INJEX, I can do anything. I can do my gymnastics and go swimming and horseback ride.
Take control of your diabetes. If you're already taking insulin or just getting started, take it with INJEX and make life a little easier. INJEX is covered by many health insurance plans and is available by prescription through local pharmacies. For more information about INJEX, talk to your doctor or pharmacist, or call INJEX customer care toll-free at 877-47-INJEX.